Okay, good aesthetic practice. Okay, all right, go to the next slide. Good aesthetic practice would be our topic, the final topic for today. The objective would be know what is a good practice, able to understand a proper practice ethics, compliances, and law, establish good etiquettes and good communication skills, know the importance and proper treatment record is very important, able to practice confidentiality, perform effective and ethical counseling consultation, able to write own consent form for related treatment. All right, these are the objectives of our topic today. Next slide, please. Okay, let's talk about good etiquette. Good etiquette is having good manners and essential to building relationship and growing business. Employing good manners will, without a doubt, have your business standing out from all the rest. Etiquette is the ability to get along with others, to demonstrate good manners, perform acts and consideration, and put others at ease. Etiquette covers not just physical presence either. It is your telephone skills, your email manners, and bedside manners too in the treatment room. Make eye contact when greeting clients and smile. Okay, next slide, please. You may want to shake hands with a new client, of course. Be mindful of different cultures in your business, likely to receive clients from different cultural backgrounds for meetings and greetings. Have your receptionist introduce the client by the name to the therapist, who will be treating them with a brief introduction on their credentials to ensure the clients has the impression they are in good hands with. Always um, introduce the client with name. Always address them calling the name so that they can feel they have a sense of establishment. Okay, they know that they appreciate it. They know that you remember them. It's very, very important. Call them by the name. Okay, try to use the client's name during the consultation process and do not form any judgment on them at all. Never say that, your hair looks like this. Why are you looking old? Why are you looking dark? Blah, blah, blah. Are you fat? Do not say all that. Just say, greet them, say them by the name, and make sure they are comfortable with you. That's a very, very important thing. All right, next slide, please. Okay. Proper documentation. All right, documentation is very important for you to safeguard yourself in the future. As well as the legal implication, client consultation is important for keeping a client record card up to date. After all, skin, hair, and nails can change over time. And if your client has been visiting you for years, then chances are they won't be in the same condition as their first consultation. So when they first came and saw you, you must document how they look like. So that number one, you know that when the patient comes the next time, you know the difference. And number two, it's very important for you to compare. So always you can compare how the client looks like before and now. Thus, keeping good clients' record is actually a fundamental part of good professional practice and is essential to effective client care. So, whatever information you take from clients, keep it confidentially. Do not expose the information. Do not expose the pictures with others, especially um, in social media. All right. Very confidential because clients are coming, they're telling everything to you, they're exposing themselves badly to you so that they have the confidence in you. Do not ever breach that confidence. It will cost you more than money. All right. Next, please. Okay. All this would be the content of your documentation. All right. Full name of the client. Date of consultation is very important. Details of lifestyle and medical history where these are relevant to the therapies you give. Brief description of the therapy or treatment given. Unusual reaction to the therapy and treatment given. Always document unusual reactions. Details of patch tests carried out if applicable. Any contraindication you identify, advice or recommendation you give, write it down. Relevant comments made by the clients about the therapy you provide, write it down so that you can improve in the future. All right. Some clients say that pain. Some clients say that it's not comfortable. Write it down so that you can improvise your techniques in the future. Details of aftercare advice. Any consent form should be kept with the record. Get your clients to sign the form. Telephone communication, text messages, emails with or about the client should be recorded in the notes. Avoid using abbreviations because jargons or offensive comments, because other than you, the other doctor also would have access to the particular documentation. So you must be really careful. All right, next slide, please. Okay, these are some of the ways that that you should practice with your clients. Okay, carry out a full consultation before each therapy. So before each therapy, you must sit down, talk to the clients, and tell them what they're going to do, so that when you actually do the procedure, they'll have an idea about what's coming next. All right, it won't be a surprise for them. Okay, you should update client information every time they visit you. And keep your paper records. Ask your clients to put their signature against any changes that you note. Ensure that you continue to give your client advice and information about the ongoing therapy and care. How long should a therapist keep their client records? 3 years, maybe, or 3 to 5 years. 3 to 5 years to keep the records would be fine. After that, but some people recommend that they could keep the record up to 7 years, but it's up to your discrepancy. We will usually keep for 3 to 5 years, depending. Well-kept record supports you in delivering a high standard of care to clients. So record, very, very important. So that when you first do recording, when you twice do recording, you wouldn't know the importance. But recording, which we will portray its importance only in the later future, when you start comparing your results, when some clients, they fail to see the improvement. So on that particular point, these pictures, this documentation, these documents plays an important role to show to them that improvement has really occurred. They maintain a reliable history of information, important information relating to your client's health, treatment, and relevant events, rather than relying on memory. We forget, they forget. So when you have a proper documentation, the clients can't say anything. They have to follow whatever you say because it's written, it's proven. All right, next slide, please. Well-maintained record will help you to give the best possible defense if someone should make a complaint or claim against you. It happens every time. They will confirm your account of the facts. They will always come to say that, okay, you promised me this, but nothing happened. When that instance happens, this is what you can do. You have a material, you have something to defend you. Furthermore, they can also help to discredit false allegation against you. They are your legal evidence of what happened. If no record is made of an event, court could deem that it didn't take place. Evidence is very, very important, friends. Legal professional working with insurers may well decide on the chances of defending a case successfully. If someone were to happen to you to prevent you from continuing to provide treatment for clients, client record should be a great benefit to the next therapist to ensure continuing appropriate care. As I told you earlier, you might not be the only doctor attending to your patients. When you're on leave or when you're on other practice, your subordinate, your substitute, your maybe doctor, which happens to be treating that particular patient of yours would have an idea about how the patients are, what are the sensitiveness of the patient, and how the client looked before the treatment, and what type of treatment were given, and what type of feedback was taken from the client. So all that information, if it's well compiled, it would be very easy for the other doctor to treat the client. Next slide. All right, next slide, please. All right, the slide is not moving. Next, please.
Hold on,
Yes,
doctor.
yes.
Yeah.
Okay, no problem. Importance of confidentiality of client records. Okay, all the client records that you keep, you should be confidential. You should not be exposing their information, their pictures to anyone else without their consent, without asking them. Okay, you should keep your client's record confidential, secure, and protect your client's information from unauthorized disclosure. Of course, if you keep paper records, you should lock them lock them away safely. If you keep computer records, you should be password protected. The aim of this legislation is to control the way the data is handled and prevent it from being used unethically. Information is wealth. They can use information and get access to anything. So information about your clients is very, very important. Do not disclose it. Your clients have the right to request a copy of their record. Of course, if they ask a copy, you can give it to them, not a problem, but only to that particular client, not anyone else. Next slide, please. Okay, a good premise, a good practice, a good aesthetic clinic, a good salon, a good med spa. A well-organized, hygienic, and safe working place. The chairs are adjusted to a workable height of the therapist, but also comfortable for the clients. Ease of access and free movement, checking the lighting is inappropriate and area is suitably private for carrying out consultation. Refreshments are offered optional. Client comfort whilst carrying out consultation, seating comfortably, heating, ventilation, any necessary modification to ensure optimum comfort. Always make your clients comfortable. Completion of all necessary records. Ensure all necessary documents are placed prior to the client's arriving. Before the client comes, everything related to them, everything related to your future conversation to them, everything related to their treatment should be ready. Don't ask the patient, the client to sit down, and then you go running around looking for documents. It's unethical, unprofessional. All right. Knowledge of the services and products available in the salon. Of course, you must have brochures to make sure that all your therapists are at least knowledgeable, at least they can explain the therapy or the procedure to your clients. Knowledge of the salon pricing structure and how to calculate charges is very important. All right. And any background music must not be too loud, of course. You can have background music, you can have orchestral music, you can have slow music, you can have jazz music, but make sure it's not very. Okay, next slide, please. Okay, standard practice of client consultation. Consultation is the process of for gaining information about the client to assist the therapist in recommending the most suitable treatment for the client. Consultation. Some clients will come in, they have no idea what they want. They have no idea what they want. So it's your job to explain it to them, to suggest to them what are best. Okay. They have no idea about what they want. They have no idea about what they need. So your duty is to tell them, is to teach them, is to educate them, is to introduce to them a proper therapy, a proper care, what they need. Okay. Analysis helps identify the general and specifics, for example, skin and nail condition, along with the correct products to use and treatment to perform. It is essential that therapists and technicians elicit information from their clients about their medical history, including any allergics, as well as checking for contraindication. Allergic history is important, and any contraindications is important. So that's why history taking is very, very important before any therapy being started, initiated. Sit down with the client, have a chat, talk to them, ask them questions about the allergics, their contraindications, their preferable procedures, or make sure they're comfortable, make sure you are well informed before you carry on with your procedures. Checking the client satisfaction, provide feedback and aftercare advice such as possible contract actions and home care products, providing opportunities for clients to ask questions. Always give space for them to ask questions. Ask questions, you must answer all the questions, educate the client, make them aware of what the treatments are and why is the treatment particularly catered for them. All right, next slide, please. Okay, so these are the information taken during consultation. Consultation record keeping, relevant contraindication, signatures, of course, refer to existing records, clear information, be accurate and work in a logical order, name, address, contact numbers, age range, reason for the treatment, occupation, sports, hobby, and medical history, adaptation and modification, future recommendations, specific products and treatment, retail sales, treatment plan, update records at the end of the treatment, update at each visit, maintain electronically paper record, the importance of signature. Okay. So what you need to do is take into consultation. You must consult the relevant contraindications. You must have the client to put his signature saying that all the information there is legitimate and the client is agreeable that the information given by him is true. Okay. And hypersensitivity is the clients having contact lenses, contraindication, any type of drugs they're taking, any type of medication they're on, any type of supplements they're taking. Have they done this before? If at all they've done this before, is there any allergic or any reactions before? All that information is a must. All right, next slide, please. All right, method of communication, verbal speaking, the tone of voice, vocabulary uses, volume of voice. There's no need for me to explain all of this to you. You're very, very good in this. Verbal, that's very important. The way you speak, the tone, the accent you speak on, you must make sure that they are super comfortable with you. And non-verbal, body language, the way you smile, the way you sit, the way you engage them, the way you talk to them, the way you stand, the way you talk, everything matters. Whatever you do, is put yourself in that client's shoes. How would you like to be treated? Treat them at the same way. All right, next slide. Okay, communication to suit different people. We are living in Malaysia, any part of the countries where people from different cultures walk in through that door to you. New clients who lack of knowledge of product and treatments. Not everybody is knowledgeable. Not everybody will Google before coming to you. Okay, you should teach them, you should educate them, you should introduce them to all the products that you have. You must introduce them to the techniques that you do. Avoid technical words, use some simple, normal words. All right, make sure that they understand. Existing clients that's knowledgeable in the industry, people will Google and come to you. Use more technical terminologies, introduce new products to them. Okay, if they come for whitening, just say you can introduce them to the newer whitening products that is different from what they came for. You can always tell them that this is a new technology, this is a new approach for whitening, and so on. Okay. Hearing impaired patient clients use visual aids, clear your speech and face and sign languages, things like that. Visually impaired, you should know how to handle them. Physically disabled people, okay, usually we call them in Malaysia. They must always have an empathy, have a different way of approach to people, to that type of community. Angry, confused clients always get this control the manner to avoid making situation worse. All right. One thing you must know: clients are always right, but they are not always. So make sure that you make them understand and do not be intimidated by them. You're knowledgeable. You're a doctor. You're a therapist. You're a salon owner. You are knowledgeable, so you know better about a particular treatment than others. So always advocate good manners. Different ethnic origins happens. A therapist should be culturally aware to ensure that they do not cause offense, of course. And many cultural differences that affect communication. Learners must understand how to vary communication techniques to meet all client needs. Learners must avoid using slang terms and idioms, avoid stereotyping, be sensitive to different religious needs. It's crucial. You should always be sensitive to different religious needs. Use more visual aid as appropriate. Be specific, be patient, seek support where appropriate. Okay, you have your therapist, you have your senior doctors, you have your associates. Always do not be shy to refer. Do not be shy to ask for help. Do not, if it's something that you do not know, do not be shy. Okay, people always, you must be always resourceful. You must be always ready to provide your client the best. Don't do if you do not know. All right, next slide, please. Behave professionally, right? It's all normal stuff. I'm very sure that you know positive body language and facial expression, good eye contact, awareness of personal space, written records completely, thoroughly, and legible, use of appropriate language, questioning and responding to questions, use of visual aid if required. Listening skills, always learn to listen. If they have tons of stories to tell, it's your job to sit down and listen. Listening skills, very, very important. Some people just won't not have a good chat with you. When you're a good listener, the impression that you're a good therapist, you're a good doctor, you're a good technician. All right. Speak in clear voice, gentle tone of voice, using appropriate language, and explain technical terminology if required. But don't get too technical. Make sure that they understand that. If you intimidate them with technical terminologies, you're not going far. Behaving in a professional manner, follow hygienic and safety working practices, keeping to treatment timing, of course, polite, genuine interest in clients, respect at all time, not gossiping, do not talk nonsense, don't talk politics in the clinic. Knowledge about treatments and products, being punctual. If you say that at this time the patient or the client comes for treatment, you should be there before the client. Everything should be ready before treatment. Before the client walks in, everything should be ready. But this shows the punctuality. All right, next slide. All right. Before executing treatment, you should have a plan. And this particular treatment plan should be discussed with your patient, with the client. So the client should be explained one by one, step by step, of what are the procedures that are going to be conducted on them. Okay. So on the information gained during draw on the information gained during the consultation to produce a personalized treatment plan for the client. The client will tell you the problem. Your job is to come up with a particular plan which suits the client or the problem concerned. Explain the treatment plan and gain agreement for the client of home. Of course, you must gain agreement before you go ahead with your client's plan. Identify any limitations to the treatment and discuss cost and frequency of treatment, of course. Before you go ahead with your treatment, please discuss the cost and frequency of the treatment. All right. Some treatment doesn't come in one. It comes with monthly, twice monthly. And it comes with, sometimes we do PRP, we do 4 sessions, monthly 4 sessions before we could see any difference. So you must tell the patients, the clients, that okay, this particular PRP treatment needs 4 sessions for you to have an improvement of your hairline. And the cost of each session, how much, and what are the complementary supplements they're going to give together with the treatment, and so on. And of course, you must always tell the clients the post-treatment care. After the particular treatment, how you're supposed to take care after the treatment. Take care of your hair, of your face, of your nails, and whatsoever. Very, very important. All right, next slide. Taking consent. Yes, consent. But most of you all maybe have never heard about consent. Consent is a very it's an essential piece of paper, a piece of agreement that has to be taken before any procedure. Again, signature and informed consent. Signed consent from clients must be obtained prior to the treatment. The consent consists of the name of the client, the aim of the treatment, what are the possible risks and consequences of the treatment. The clients are aware of the risk and consequences of the treatment. The client agreeable to the treatment despite being explained about the consequences and risks, and the client puts his or her signature on a piece of paper with consent. That is a consent. Consent to treatment based on the consultation, identification, risk, and benefits of treatment, and other treatment options available. Parent or guardian consent must be obtained for minor prior to any treatment. So all procedures must have a consent. All right, next slide. Okay, aftercare advice, of course, as I told you, very important. Some people think that so after the treatment done, okay, fine, there's nothing for me to do until the next month, until the next session, I'll be absolutely perfect. No. Update relevant records prior to and following the treatment to meet salon and industry requirements. Record must be detailed and legible. Follow required confidentiality policies, procedure, data protection, and any other relevant legislation. Aftercare to include follow-up treatments, maintenance, professional product recommendation, advice on improving skin, nail, and body condition contraindication. Must always tell the clients on what they need to do, what are the products they need to do. You can even introduce your products to them. What are the care that need to be taken until the next appointment? What are the do's and don'ts until the next appointment? What are the type of diets they must include? They must practice every day, all these things. Okay, they might come to the next session without any improvement. Why? Because the aftercare product that we're using is not optimal. Because the aftercare do's and don'ts they have not been explained to, and some other factors they are not being aware of. So, in order for you to have a good improvement or persistent improvement of your therapy to the clients, you must always emphasize what do you call that aftercare advice to them. Sit down, chat with them, talk to them, tell them what they need to do after each and every procedure. Remind them. Okay, next slide, please. Okay. All right. These are the update changes in clients' personal details. record results of tests, identify factors limiting or affecting the treatment, techniques used for the treatment in detail, product used for the treatment and timings, of course, outcome of the treatment, success of the treatment, client satisfaction suggestion for the next treatment. Use clear and accurate language and ensure the record is completed in full. If the record is handwritten, the writing must be legible. All these are steps or what you need to do when you're taking information about the clients. All these are the records to be kept for the next session so that we can compare the improvement. And of course, always you can use this to tell the clients that whatever they're doing is right or whatever they're doing is not right. All right, next slide, please. Ethical consultation. Ethics involve learning what is right or wrong and then doing the right thing. However, in organizational consulting, the right thing is not always easy to identify. Ethics includes the fundamental ground rules by which we live our lives, value that guide how we ought to have behaved are considered moral values, for example, values such as respect, honesty, fairness, and responsibility. Statements around how these values are applied are sometimes called moral or ethical principles. Ethical consultants must have a set of principles which defines ethical behavior and guides the consultant's actions towards those behaviors. Next slide, please. Okay, ethical guidelines. Do not do harm to your clients. Keep clients' information private unless the client or law requests otherwise. Do not create dependence by you on your client, nor by your client on you. Anticipate and avoid conflicts of interests. Do not act in official capacity as an advocate for a client. Do not go beyond your own expertise and do not skip the discovery phase of consulting. Do not do harm to your clients. If you do not do the procedure, if you do not know how to do the procedure, don't do. Don't take risk. Your client is not a lab right for you to test your skills. Keep client's information private. All right, the client's information should be always private. You should be always accessible to you and your clients only. Do not create dependence. All right, do not think that the client has to always be dependent to you, has to always come back to you, has to always take treatment to you. Do not create that type of environment. The environment should be friendly. They should be coming deliberately. You should be coming independently. They should be coming happily to you, not because of your forced. All right. Do not act in official capacity as an advocate to your client. Okay, this means that you do not support your clients other than the therapy that has been given. Okay, do not go beyond your own expertise, right? If you do not know, do not do it. Always good. It's always all right to ask for advice. Okay, next slide. Advice from, of course, your seniors. Example of unethical or poor consultation. Because the consultant offered guidance or advice that was well beyond their expertise, the client organization implemented action plans that were destructive to the organization. Because the consultant did not conduct enough discovery or diagnosis to further examine the client's reported issue, the client's organization implemented action plans that were incomplete or destructive to the organization. Because the client wanted the consultant to come to the same consultation about the issue as the client somehow did not tell the whole story to the consultant too, whom in turn made wrong recommendation based on inadequate information. Make sure that you and your clients are well informed to each other. You need to tell the client, be liberal about whatever the client needs to know, and you try to extract all the information that you need to know from the client so that the treatment would be optimal. Next slide, please. Okay, this is an example of a consent form. You can have your own consent form, but these are the example of consent form. The format, everything is inside the consent form should be in a proper format, but the content is always liberal. You can have your own content, or you can go through this later. You can have one consent each for each procedures, or you can have one general consent for all the procedures. Right, next slide, please. There we go. Thank you so much. And we have come to end of our session. And I hope that all the participants today understood all the topics. And this will help you to maneuver well in your practice. I hope so. All right. Thank you so much for your patience. Thank you for participating.
Thank you, Doctor.
Oh, you're welcome.
Thank you, Dr. Varan, for the excellent lecture, and thank you for the rest of students.